Tonight, we wanted to go in depth on the perception of vaccines in our country. Last fall, NBC News did a sobering investigation into the steady decline of childhood vaccine rates in our country. They wrote, quote, "A generation ago, infectious childhood diseases were nearly wiped out in the U.S. thanks to immunization programs. We've discovered how that remarkable success is being eroded by efforts to undermine faith in childhood vaccines." Let's talk about whooping cough, for instance. According to NBC News' investigation, the CDC logged 26,632 cases of whooping cough last year. The last time the U.S. saw so many cases was more than a decade ago, in 2014. And let's be clear, whooping cough is preventable. A local doctor being honored tonight with a Philadelphia Citizen of the Year award is trying to combat this trend. I'm talking about Dr. Paul Offit. You may have seen him on television over the last few years. He's the director of the Vaccine Education Center at CHOP. And I talked to Dr. Offit about how they're reaching families in Philadelphia and the mistakes they may have made during the pandemic. What have you found is most effective in reaching these families at this point?
I think you have to explain to people that choice not to get a vaccine is not a risk-free choice. It's a choice to take a different and more serious risk, and this is what that serious risk looks like. I mean, we see children come into our house with whooping cough, or we see children come into our hospital with influenza, flu. And in many ways, that's preventable, and it's hard to watch children suffer needlessly.
A lot of people who may be very well-meaning may have questions about why children, for instance, have so many vaccines that they need to receive. And of course, there's so much mis and disinformation online. What did you learn during the pandemic about the best ways to reach people?
I think we did learn a lot during the pandemic. I think we learned as we went. I think so. For example, in 2020, when we didn't have anything, we didn't have vaccines till December. So what do? We restricted travel, we closed businesses, we closed schools, we isolated, tested, quarantined. And I think that was done in sort of a unilateral top-down fashion when we should have been working with schools. We should have been working with businesses to see how we could still accomplish what we needed to accomplish without as much disruption.
And one of the reasons that Dr. Offit is being recognized tonight is for his outspoken criticism of some of the Trump administration's moves on vaccines specifically. And I asked Dr. Offit about how his sometimes sharp criticism could affect his ability to reach families who support the president. Here's part of what he said earlier.
I think you just have to explain things simply and compellingly and compassionately so that people understand why it's important, for example, to get a vaccine against COVID or to get a vaccine against flu, because not everybody can be vaccinated. I mean, there are people in this country who are getting cancer chemotherapies, they're getting immune suppressive therapy for their autoimmune diseases. They depend on those around them to protect them. Don't they count? Don't they matter? To me, it's like the medical freedom movement on the one hand and the don't I count movement on the other hand. Freedom for whom? I mean, if you want to send your child to a school who's immune compromised, I think it's important to know how many people aren't vaccinated in that school that would put your child at risk. Freedom for whom?